Congressman Eric Cantor of Virginia is the House Republican whip. He is expected to be the majority leader in the new House with John Boehner as Speaker. Congressman Cantor, thanks for joining us.
Katie, good to be with you.
Let me ask you about health care reform. I know in the Republicans' Pledge to America, repealing health care is a major step on the agenda, but how exactly do you propose to do that?
Well, Katie, tonight's election is about listening to the people, and that was the message that's being sent across this land, is they don't like this health care bill, and they want to see us focus on jobs. And there's just been no results that match the expectations of the people. So I believe that when we take majority in January, I hope that we're able to put a repeal bill on the floor right away, because that's what the American people want. They understand that this bill is going to bankrupt this country and take away the health care that most people in this country know and like. The problem is, Katie, we haven't focused on the problem, which is the cost. It's too expensive. Healthcare is just, the costs are out of control, and we've got to go back and begin to give the American people what they want, which is lower costs and higher quality,
but Congressman
not this abomination that was passed.
I've just got to interject and tell you that may be true that many Americans do not like healthcare reform, but according to our exit polls, Congressman, 48% of the people we talked to wanted to repeal it, but 47% wanted to leave it as is or, in fact, expand it. So this is hardly a mandate if you listen to our exit polls.
Well, I just saw the polling that you just showed, and it said that 80-some% of Republicans are for repeal, and actually 51% of independents are for repeal. So it seemed to me there's a majority of Americans who say, you know what, start over. We don't like the status quo, and we've got to get costs down and give people a choice and start accentuating the doctor-patient relationship and get government out of the business of deciding the proper care. That's what Republicans are going to be about, Katie. That's what the American people are saying tonight. You know what, this administration's had 20 months, and all the promises that have been made about the most important issue, which is the economy, have been broken. And they are fed up, and they have a reason to be fed up.
Well, let me ask you, you guys have said you are going to cut $100 billion in discretionary spending. That doesn't include military or entitlement spending. So what specifically will Republicans cut?
Well, we have put on the table an attempt to put discretionary spending back to '08 levels, and that means an across-the-board reduction in spending. And if you think about it, Katie, in '08, the sun rose and set. And we're saying, let's get back to pre-stimulus levels. Let's get back to some fiscal discipline. That's a first step that we can start and bring down the kind of spending that has occurred in Washington. But, listen, the American people, they know that they can go about creating jobs. The small business people are waiting for a signal from Washington that they're going to stop making it more difficult to put capital to work. That's what tonight is about, too, Katie. It's about the fact that people are looking at Washington and saying, don't you hear me? We want opportunity. We like success. Stop maligning those who are successful.
All right, Congressman Eric Cantor, again, thanks so much for talking with us tonight. We appreciate it.
Thanks, Katie.